I'm going to share my screen. If you have any questions throughout the presentation, feel free to put them in the chat. I'll also do Q&A at the end. So let me go ahead and share my screen with you guys. All right, can you see my screen? We're good?
Yes.
All right, so today I'm going to talk you through how you can prevent injuries through this training cycle. So whether it's your first 10K or you've done 10Ks before, you are at risk for injuries because you're running, or even if you're walking, you're still at risk for injuries because now you're starting to really increase the amount of mileage that you're doing each week, and especially when it starts to feel nice outside. So we really want to make sure that we're prioritizing certain things throughout the training cycle so we can get to the start line and the finish line pain free. Okay, so I'm Dr. Lisa, or I'm Lisa. You can call me what you want. I'm a physical therapist. I help runners prevent and treat injuries. I've helped runners from around the world. I've worked with really big name brands such as Running Warehouse, Shocks, Superfeet. I've been in Runner's World many times, HuffPost. I've worked with Ultra to help determine how they can help prevent plantar fasciitis with their shoe. And I'm really excited to be talking with you guys. Feel free to follow my Instagram. There's a ton of tips on there, whether you're rehabbing an injury, you're looking to strength train, you're looking to prevent an injury, dynamic warm up, whatever it is. I probably have it on my Instagram, and you can always message me on there as well. I also have a top 50 running podcast called the Rehab for Runners podcast, where I really talk through certain injuries, certain mindsets, whether you're a beginner runner or you're experienced. I think you'll find some nice tips in there that you can implement and you can become a stronger runner. So let's get started. So the outline for today, we're going to go over a couple things that's going to make up your injury prevention and allow you to have a solid race day. So first, we're going to go over how you can determine your race day goals, how you can prevent injuries during training, some common running injuries just so you're aware of them, types of strength training that you can do that will actually help your running, how you can master your pre and post run routine, some running accessories that may help you throughout your training and on race day. Your race day routine, how you can kind of nail that down so you can have your best 10K. And at the end, I'll give you a dynamic warm up, follow along, and some post run stretches that you can do as well. I'll share that in the chat as well. All right, so we've already gone over this, but put in the chat if you're just joining who has run a 10K before, or if it's your first one, I want to hear in the chat. I don't, let's see. I don't know if I can see the chat, but I've run two 10Ks in the past. I've run a couple 5Ks, three halves, and I'm on my third marathon, I believe. I'm training for Boston right now, actually. So the 10K is a little bit tricky of a race, if you ask me. I think the 10K can be challenging. It definitely depends on your goals, and I think it's a great challenge, especially if you want to get into running more, or you really want to push yourself. I think the 10K is such a good distance. So let's talk about some race day goals, because ideally the next couple weeks, or the next however many weeks until the 10K, you really need to know what your goals are on race day in order to kind of determine what the next weeks are going to look like leading up to race day, because otherwise we're just kind of winging it. So we really want to start with the end in mind. So ideally you're aiming for one main goal per race. So if it's your first 10K or you haven't run a 10K in a while, then I recommend that your goal is just to have fun and to finish strong and enjoy your time out there. If you're more experienced and you know what your pace is, you may be aiming for like a time goal pace or time pace. You may be having certain goals like, if you've been dealing with an injury, you just want to finish without pain, that stuff like that. Maybe you want to finish really strong. You don't want to be finishing where your splits are a little bit on the slower end. It just depends. It really just depends. But I really recommend just have one main goal per race. So ideally, we're picking action-based goals versus outcome-based goals, which I'll go over in the next slide. And it's really, really important to celebrate every single win. So if you're on a week where it feels a little bit more challenging and you're like, oh, I'm really struggling to get this run done, but you do it. You go out there and you do it. You need to be proud of yourself for it. Sometimes we take runs for granted, but it's really important to tell yourself that you are proud of yourself every time you get out there when you didn't feel like it, every time you pushed yourself when you really didn't want to, and just really celebrate every small win, because those are going to lead to a really positive mindset, which is going to help you do well on race day. It's really important too. I don't know if you guys have ever read this book. I highly recommend it though. It's called The Gap and the Gain. And basically, you want to focus, and this goes for like everything in life, but I'm just going to play it into training. But you want to focus on what you can do, not what you can't do. So I'm a physical therapist. I'm also a run coach. So I mostly treat runners when they're injured. And a lot of the time when they're coming to me and they're injured, I am having to adjust their mindset because they may be injured to the point where I'm not letting them run, and all they can think about is the fact that they can't run. But they've made these gains week after week. Maybe now they're able to do like a certain exercise that's not painful, doing certain things where there's clearly progress. And that's what I kind of shift their mindset to focus on, is what can you do? So in this case, if you're training for this 10K and you've never run that distance before, you're going to start running more mileage, and it might be more mileage that you're not used to. So you really need to, instead of saying like, oh, I didn't hit my paces for this one run, it's okay to recognize it, but don't beat yourself up over it. Instead, think, oh my gosh, I'm so proud of myself for actually going out there. Like months ago, I wouldn't have even thought about doing this workout. So really focus on what you can do, not what you can't do. It's okay to acknowledge what you can't do, but you don't need to dwell on it and let it affect your mindset. And then if we do too much, it increases our risk for injury. So these action-based goals versus outcome-based goals, this is really important because ideally we just want to focus on what we can control. So these action-based goals are where we're focusing on, like, our goals aren't just, that we're able to complete a run within 30 minutes this week, or complete a 10K 1 hour and 20 minutes, because those type of goals are more outcome-based. We're focusing on our time at the end. But if we focus on some action-based goals, maybe we're focusing on the fact that we'll go out there and do a run walk 3 days this week, or we will fuel and eat breakfast before our run walk, or we'll go to bed at 10 p.m. every night, or we'll put our phone down 1 hour before we want to go to bed. Like things that you can actually be in control of, you're going to see much more like progress, and you're going to have a better mindset. Because I used to run with these outcome-based goals, and I used to basically run an entire marathon hoping I would get to a certain time at the end, 4 hours and 20 minutes later. And I would beat myself up because I didn't get my certain time I wanted. So I had to, and it's like, dude, you just ran a marathon. Like, you should be proud of yourself. But I started to switch it into action-based goals where it was like, okay, I'm going to fuel every 30 minutes, like just things that I was in control of. And that allowed me to just have a better mindset, and also just be more proud of myself, instead of dwelling on these things that only, would take into effect if all the stars were aligned basically, and I had a really good day. So I really encourage you to focus on these action-based goals, because then it's just going to give you a better mindset as well. All right, so put in the chat if you've had a running injury, or if you've been injured while you're running, if you've had a stress fracture from your running, if you've ever been to PT. I'm sure some of you guys have been to PT. I'm sure some of you guys have had an injury running, especially if you've run 10, or was it 10 Ks? Yep. Ooh, plantar fasciitis, that's the worst. Okay, so the thing with running injuries, you cannot decrease your risk for every single one of them because let's face it, if you're running, then you're an athlete and athletes get injured and sometimes they're out of our control. But if we do, research shows if we develop an effective injury prevention program, we can reduce our risk for running. 80% of runners get injured every single year. A lot of them, I'm going to go over the reason why, but we want to make sure we're implementing and prioritizing injury prevention. Otherwise, our chance for injury is going to go up. So, a couple things to focus on with injury prevention because it's a big net, it looks like. It's a big spider web that we need to focus on. It's not just like do this one thing, that'd be really nice, but that's just not the case. So, a couple things to focus on for injury prevention. First, our rest days. I do recommend at least one day of rest each week. And a rest day is where you do nothing. You can go walk, you can do really, really light activity, but you're not running, you're not strength training. The next would be your running form. So just paying attention to your running form, see a PT if maybe you need help with your running form. Your shoes can make a difference in injury prevention as well, making sure you're fitted for shoes that are appropriate for your gait, for your arch, for your foot. They work with you. They actually feel comfortable. They're not just like the most popular running shoe on the market. Nutrition, fuel, and hydration. I believe Emily has talked to you or will be talking to you more about that. Stress and mindset. So making sure that we can reduce our stress and improve our mindset because they're determining there's a really big correlation now between stress and injuries because of the hyperactivity of our nerves. So being able to control stress and if you have anxiety as well. Sleep plays a really big role in injury prevention because it's how our muscles recover and repair themselves. So as you start to run more and more, maybe even like, the week of race day or the week before race day, you might find that you're sleeping more because your body needs more time to recover and repair. And it's really important to prioritize that and let it sleep more. Your training plan is going to play a really big role in injury prevention. I'll go over that in a second. Your warm up, so being able to go through a dynamic warm up, and your strength and stability. So if we're strong and we have a lot of stability in our joints, then that's going to decrease our risk for injury. And also our speed workouts. So I'm going to go into this in just a second, actually. Okay, so in terms of, I know I said like the speed workouts and the training plans, so it's like, I'll talk about this in a minute. So here it is. So 60 to 70% of running injuries are caused by training errors. So you can think of these training errors as like, maybe you went from like, in the past, maybe you've gone from like 0 to 100, where it's like, you ran 0 miles one week and then the next week you ran like 15 miles or something like that, where it's like a really big increase week after week. Maybe you have increased the frequency of your runs. So instead of running once a week, now you're running 4 times a week or 3 times a week. So all of these things can basically increase the load to our body, which increases our risk for injury. Another really common one, and this is why I put speed workouts in and your training plan in, is because a lot of the time what I see with runners is it's not always like the amount of mileage that they've increased, or it's not necessarily that they've increased their frequency. A lot of it comes down to the intensity of their run. So ideally, we want to have certain runs along the week. And if you're like, Lisa, this is my first 10K, like I don't even care about speed, then you might have just one speed and that's completely fine. But if you're doing like a speed workout and you have like different types of runs throughout the week, then it's important to have runs with low intensity pace, runs with moderate intensity pace, and then runs with those higher intensity pace. So being able to not run all of your runs as hard as you possibly can is very important. So ideally you're pulling it back a little bit during your runs, because your runs during your training that is not your pace for race day. I can tell you that right now. So you really need to slow down a little bit during your training runs. Okay, so these training errors that the research is talking about, So I kind of went over this, but too much too soon with your weekly mileage, too much intensity. So you're going out way too hard with your runs too often. And then you're just running way too frequently, like, especially if you weren't used to running that frequently. So being able to like slowly ramp up the days that you're running instead of just full force throwing it on your schedule. So some other causes of running injuries, kind of went over this, but your shoes can play a role, stress can play a role, traumatic events happen. I mean, you can't really fix it if, you can prevent trying to twist your ankle, but if you step, wrong, you don't see the curb and you twist your ankle, like things like that happen. Weakness or joint stiffness, your running form, if you're running on new terrain, like if you're running a lot of incline or decline or rocky road or anything like that, lack of sleep, and poor nutrition. So just note, it's not one thing that's causing an injury usually. Even when I see someone that's injured and I'm going over their training plan with them, I'm going over their nutrition with them, I'm going over their sleep, their stress, everything. Even if they're like, Lisa, I just have plantar fasciitis. I'm like, it doesn't matter because your body works as a unit. It's not just like, hey, go strengthen this one muscle. So it's really important to view the injury as like a whole picture, not just like, oh, shoot, I just need to do these exercises. So some common running injuries, let's go into a couple now just so you're kind of aware of what the pain may look like or where it is. So the first one that's really common is shin splints. So this is basically pain when you're running in your shins. So you'll have pain in about usually like the mid shin. A lot of runners may have it like in the inside of their shin as well. But it's described as a dull ache or sharp pain. It usually goes away after running. So that's a big thing, is that it's like it comes on when it's running and then it goes away once I'm done running. You can have swelling. It might be tender if you touch it. You also may have tightness in your calves. I hear that a lot, like you really want to stretch your calves. And I'll go over in the next slide the difference between this and a stress fracture. But basically with shin splints, the big thing to note is that it goes away after you run or after you're done running, and then it comes on when you're running. So it's not something that lingers 24 hours. It's just during activity. So this is versus a stress fracture. A stress fracture comes on, it can come on from those training errors that we talked about. But basically, when you have a stress fracture, you're like, it hurts right here. Like you are pointing to where you feel the pain and it's very localized, versus like if this is my shin and I have shin splints, I'm like, it hurts here. Like it's all along this area. Stress fracture is very like, it hurts right here. Okay, you also have the pain outside of running because it's a break in the bone. So it's not a musculoskeletal situation. It's an actual fracture from the response of the load that you've put through the body. So you may have night pain. You may have pain when you're just sitting down at work. And it's highly recommended to see a doctor so you can get screened for it. If you have plantar fasciitis, I know someone said they had plantar fasciitis, so you know this all too well. Plantar fasciitis is very annoying to have. So you'll have pain at the heel and the arch. You'll know you'll have it because one, you'll be in a lot of pain right when you get up, but also you're like limping to the bathroom, and then it gets a little bit better. And then as you're on your feet more, it gets worse. So the big thing here to note is that you have a lot of pain in the heel throughout the arch. Runner's knee is also really common. So this is pain that can be like around or under the kneecap. You'll have a lot of pain when you're walking or running, going up and down stairs, but not necessarily at rest. ITB syndrome is kind of similar to runner's knee, but this is more pain on the outside of your knee and the outside of your thigh. This is where the area to address is more your hip, and you'll have more pain as you run or walk. So this is where like strength training can play a really big role in preventing injuries, because then you're addressing all these areas that you would be addressing in rehab. You're just doing them at a higher level in your strength workouts. So if you start to feel any pain when you're running, the first thing that I want you to do is just decrease your weekly mileage. So if you have like a 4 miler on the schedule tomorrow and you start to feel pain, then I would say drop it down to like a 2 or 3 miler. You also want to decrease your speed. This is really important because pain comes on at higher loads. So that also means like running faster. So we really want to pull back our speed into more of a jog. You can take 2 to 3 days off just to see, like, especially if you have a lot of pain when you're walking, just to see, like, is it going to go away? Because if you've been running for a while, you probably know like some running injuries just come and go, and you're like, thank goodness, like, oh, thank you to the running gods, because some of them can just come and go and they last 2 to 3 days and they're gone. But if it doesn't go away, then you need to start your rehab exercises. Maybe you need to see a doctor if you're worried about a stress fracture, but you definitely need to start those rehab exercises ASAP, because most of the time running injuries, when they come on, they're not traumatic. I mean, of course, some of them can be, but they're usually progressive. And that means like if you're having pain on your run one day, you may start to feel it. And then the next week, you might be like, I feel it a little bit more. And then the next week, you're like, okay, like, should I still be running? I'm starting to feel like I should probably address this. So it's something where the pain is like gradual, but it keeps getting worse as you keep running on it. Okay, so let's talk about some ways to prevent injuries. So it's the same thing that I've kind of said a lot, but shoe wear plays a really big role. So I really recommend go to the local shoe store, find a shoe that works really good for you and your foot. It is okay if you try on like 10 pairs of shoes because you just have no clue what shoe you want. That is perfectly okay, because there's a lot of shoes on the market right now, and some are very, very similar. So you really want to make sure you pick one that works best for you. You really want to be prioritizing sleep. It's recommended 7 to 8 hours of sleep each night just to allow your muscles to repair. Stress, really reducing your stress. Some people say like I run for my therapy, but if you also need, it's not a substitute for therapy. So make sure, you are dealing with your stress in an appropriate way. Your training schedule, making sure that you're preventing yourself from overtraining. Take those rest days. They are very important for the body. The rest days are part of training. Okay. Slowing down your pace. This is something I learned after my last 10K, was that I really needed to slow down my pace during my training runs. Your pace during your runs, if you're not doing like a speed workout, then your pace during your runs should feel like, if you're talking to yourself when you're running like I do, it should feel like, oh, I feel like I could go at this pace for a very long time. Because again, your pace when you're running like throughout the week is not your race pace. It's to allow you to build your endurance. And that's like a really big mistake that runners make. So say my race pace is like a 9:30-minute mile. My easier effort pace should be like an 11 to 11:30, just to give you an idea of what that looks like. We should be including strength training just to address areas of weakness, prevent injuries. You can add in cross training. So this would mean like the bike, Pilates, rowing, swimming, elliptical, something like that, where it's just you're adding something else in that will improve your running, and then a warm up as well. Okay, so strength training. This is one of my favorite topics because I think it's just so important for runners to strength train. I think every runner needs to be strength training. I think it's the key to becoming a great runner. And the right strength program can really help improve your running. So your strength training should not be something that's, making you super, super sore to the point where it's affecting your runs. It really should be helping your runs. So that might mean that you're reducing your weight when you're lifting. It might mean that, you're reducing the reps that you're doing, but it's really important. We should try to strength train 2 to 3 days a week. And when you're strength training and you're going into some 10K training, you could do 2 days of strength training each week, and then you'll stop 2 weeks, 1 to 2 weeks before the race, and you'll be good. So the muscles we want to address when we're strength training, I'm going to go through some of these. These are more of like what we call the powerhouse muscles. So think about like when you're running, it's the muscles that are producing the strength and they're producing the force to get you to move forward. So you have the calf muscle, which is your soleus. You have the quads, the iliopsoas, the hamstrings. The gastroc is also a calf muscle. Rectus femoris is quad, and the glute max. So the big ones, when you're running at a faster pace, you can kind of see this chart here, which I really like, is your iliopsoas, which is your hip flexor, really turns on when you're increasing your speed, your hamstrings, your quads, your rectus femoris, and your glute max. So we really want to make sure that we're, really addressing those in our strength workouts. So some examples of exercises. So just so you know, I have like a ton of these examples on my Instagram, but basically squats are great. Single leg squats are even better. Deadlifts, single leg deadlifts, lunges, side planks, or planks to really address the core, lateral lunges and step ups, and of course, upper body, because we use our upper body when we run. You may notice like there's a lot of unilateral stuff in this because we're running on one leg at a time. So we have to make sure that we're addressing the unilateral strength and stability, not just, everything on two legs. So I put in like a sample weekly schedule here, just in case you want to see like how it could be laid out. So you could be strength training Monday, Wednesday, and Friday. You could run Tuesday, Thursday, Saturday, and you could have a rest day on Sunday. Now, if you want 2 rest days, you could always take out the Friday strength training. Or if you want to run 4 days, then you can always take out one of the strength training and then add it as a run day. So you just have to make the weekly schedule work best for you, something that you could stick with week after week, not just, for 6 more weeks or however long it is. You really want to make sure that this is sustainable. Okay, so pre-run, we have a dynamic warm-up, which is really important. All you need is 5 to 10 minutes, and it'll help prep your body for movement. So think about like knee hugs, think about like jumping jacks, high knees, something like that, where like you are increasing the blood flow. Now, ideally, you're also fueling before your run, and it doesn't need to be like a protein bar. It just needs to be something with what we call simple carbs, which Emily talked about, or she'll talk about. I'm not sure about y'all's schedule, but something really easy that you can eat that your body will digest. And then after your run, it's really good to not just like stop running right when you get to your house and then, you walk inside and you go in the shower. Like I would really try to incorporate 5 to 10 minutes of a walk right after your run, help bring your heart rate down. It will also help with joint stiffness, so making sure your joints aren't super stiff after your run. And then you could always go into like some stretches, some mobility exercises as well. And then you'll want to take in some protein and carbs within 30 minutes so your muscles can repair and you can be ready to go for the next run. So again, these training runs, majority of these runs should be at an easy pace or an easy effort. If this is like your first 10K and you have only run like 3 or 4 miles at a time and you're kind of intimidated to run like 5 or 6 in training, it might be helpful for you to run for time instead of distance. So instead of thinking like, oh my gosh, I'm going to run like 5 miles today, like I'm really nervous, you could instead say I'm going to run for 55 minutes or 60 minutes today, just to like kind of flip your brain and like get rid of that mindset of like the nervousness mindset. If this is your first 10K though, really focus on your consistency week after week. I wouldn't necessarily worry about hitting a certain pace because, the big goal here would be consistency and increasing your endurance. So speed can definitely come, but focus more on the consistency of your schedule and then really slowing down to increase your endurance. Real quick, I wanted to go over some shoes and running accessories. First things first, there is no one shoe for every foot. Definitely get fitted for your shoes. And I do recommend that you only run in your running shoes just because they only have so many miles on them. You're paying for every single mile on them. Running shoes are expensive, so try to have like, you know, shoes that you're walking in, shoes that you're strength training in, and shoes that you're running in. So some of my favorite ones. So I'm going to start with the Spy belt here. It doesn't have to be the Spy belt, but just some sort of belt where you can carry like your phone, your house key, whatever it is. You can see I just put it on my waist here. And I also put some fuel in it if I need it. And it's really, really helpful. I wear it on every single run. I wear it on my dog walks, like everything. These Shokz headphones are really nice too. I've worked with Shokz. I really, really like them, but I have them right here. Basically, they go over your ear. So as a female runner, I like it because I can hear my surroundings and I can still hear the music. So in both these photos, I have my Shokz on, but basically they use bone conduction. So it's not like I'm sticking, you know, headphones inside my eardrum and I can't hear anything going on outside of me. Some sort of good sock is a really good idea. Some sort of really good cushioned running sock. Just pick one up, you know, pick one or two pairs up from the running store. Really recommend, especially if your feet blister easily. These Shokz headphones I have in this picture on the left are Shokz. These Goodr sunglasses, goodness. Some sort of good sunglasses. I'm using Goodr here, but it's Goodr. And I believe they sell them at the running stores. They also sell them at Target now, I think. But these are some really good sunglasses. I think they're like $25 and they're polarized and they're great for running. And last but not least, because it's starting to get hot in Richmond, is some anti-chafe balm. So you'll want to put this where you chafe, so your showers are not miserable after your runs. So the week of the race, it's really important to focus on hydration. You want to really hyper focus on your fuel. You're mentally preparing for the race in a positive way. So you're kind of walking through, you know, the race, how you're going to be running it, everything like that. You're picking out your clothes based on the weather and you're keeping your runs at an easy pace the week of the race. The day of the race, really important to enjoy yourself. Enjoy the crowd, enjoy the atmosphere. Don't go out too fast with the rest of them. Focus on how far you've come. This is a good time to reflect, like, hey, last year at this time, I did not think I'd be doing this. I can't believe I'm doing this. I'm so proud of myself. If you have a time goal, I do recommend you focus on a pace range. This is something that has been super beneficial for me and my runners, but basically, like, if your goal is, let's say, like an hour for the 10K, then break that down into what the average pace is per mile, and then give yourself like a 20-second gap for a pace range that you want to hit for each mile. So you're not just focused on like the 1 hour, the 1 hour, the 1 hour. Focus on hitting the certain pace range each mile. So then, you know, you have some flexibility each mile depending on how you're feeling. So what did I learn from my first 10K? A lot. I learned to break up the race. So basically, like, I saw it as like the first three and the last three. Just break up the race in your head, break it up as you want, especially if you're intimidated by the 10K distance. Focus on the people, distract yourself. Feel free to people watch. This is a great time to people watch while you're exercising. And remember, you guys are all in it together. It's not a competition. It should just be a competition with yourself, but you're all in it together. You're all here to have fun, move your body in a really positive way. And it's all about the journey more than crossing the finish line. I think it's really important to note, like, you know, the journey is way more important, what you're doing up to the 10K, and then the celebration is the actual race. So I'm going to put in the chat a dynamic warm-up and post-run stretches that you can follow in the chat. So I'm going to do that right now, so you guys have it. But let me know if you have any questions. So these are two follow along videos that you can do. They're both less than 10 minutes. So if you're like, I don't have time for this, Lisa, like pick a couple out. They're both less than 10 minutes. So you can have a good dynamic warm up, and then the post run stretches, you can do them after your run. But I can take any questions now.
Feel free to come off mute if you have questions.
Lisa, thank you very much. This is so important when you are doing the 10K and training. It is more than the typical 5K that people do. So it is important to hear about kind of the injury prevention. Could you address a little bit about, incorporating maybe the concept of run walk, kind of the Galloway run walk into, if you are feeling a little bit off and maybe using something like that to address kind of some issues you might be having?
Yeah, for sure. Thank you, Tom. I appreciate it. I think, the run walk method can be a great way to increase your endurance, especially if you are, super intimidated by the distance, or your endurance just isn't great to start with. Then the Galloway method is basically, for those who don't know, it's a run walk method. So you could do like a 3 minutes of running and a 1 minute of walking, and you basically repeat yourself until you're done with the race. It's a great way to practice a new distance as well. So it's something that you could, so there's two ways you could go about this. You could either do, like, say you're in the 10K, you could either do, you're running until you're just really fatigued, and then you go into the Galloway method of the run walk, like, in your head, when I hit this certain point, I'm going to go into the Galloway method. Or you can just start it from the beginning, and this could be something that you're practicing in your training runs. I know they have different, I don't know, Tom, do they have like different recommendations on their website? Do you know?
If you read some of the Galloway books, he'll say you can do any interval that you want. You're
Right.
probably no more than a minute walking, but anything you almost have kind of like a target, like you were talking about a goal, or you almost have kind of a target that you want to do by the end of the race, and that kind of helps to dictate maybe the interval that you use. But part of the concept is that you're recovering when you're actually doing the walking.
Mhm.
So the running, you're stressing your body, but then the walking, you actually are recovering. So you feel a lot better at the end of the race than you really do. And that you find, like you were talking about, you run until you kind of feel like you can't really run much anymore, and then you go to the Galloway, which is probably a good concept to use. But if people try to go out and run the whole thing, and they can't really do that. Then they start walking, and then they're totally exhausted. The whole
Mhm.
concept of run walk is you can actually run it faster doing a run walk, because
Mhm.
you're going to be running probably faster than you would be running kind of initially, and also. But anyway, it's an interesting concept. We actually incorporate that in our training program at the Y that we use, and at the Y that we do. And believe it or not, I'm actually the run walk coach. So I so I'm a
That's
proponent of
awesome.
it. So it's
That's awesome. Yeah, I think it's great. I mean, so I'm going to put in the chat for those interested. There is a book. So it's basically like a run walk method invented by Jeff Galloway, and he talks you through how this can be really beneficial for endurance. Like Tom said, like recovery, because you're able to walk and you're not totally exhausting yourself with just running. So really great book to read, especially if you're interested in it. And like you said, like there's not like one way to do it. You can kind of pick and choose what works best for you, but definitely practice it. And that brings me to another point where during your race, definitely have a plan B. Like if you're like, okay, I'm going to run until I am just so tired, and then have that plan B to what you're going to do next. I think that's really important. And that could be transitioning into the Galloway method. So transitioning into some sort of walk run, but have some sort of interval in your head, like I'm going to run for 3 minutes, walk for 30 seconds, or something like that, where you just have it in your head, just in case you need it, or in case you want to go that route with your plan. Any other questions?
Does anyone else have any other questions?
I just want to say thank you so much for the information. I am a walker, so a lot of what you shared, I absolutely can utilize. So thank you very much for that. I hope
Yes.
everyone has a great night and enjoy the journey.
Absolutely. That's awesome. Thank you for sharing that.
You're welcome. Good night, everyone.
Good night. You guys can always feel free to message me on Instagram if you have any like individual questions too.
I'll make sure that I'm gonna stop recording real quick. If I can find it.